My name is Dr. Habib. I'm a pediatric endocrinologist. I've been in practice for 40 years, and today I would like to talk to you about the connection or relation between a mineral called magnesium and its relation to diabetes. Magnesium is called the insulin twin. What does magnesium do? Magnesium is a basic building block of life, and it is a very important factor for enzymes that are involved in carbohydrate metabolism, in glucose metabolism. As I mentioned, the magnesium and insulin are like twins who need each other. Without insulin, magnesium does not get transported from the blood to the cells. And without magnesium, beta cells will not secrete enough insulin, or the insulin it will secrete, it will not be effective. So as you can see, that is said, magnesium deficiency can cause both or contribute to the development of both diabetes type 1 and diabetes type 2. What does low magnesium do? First, it will decrease insulin transport and storage. It will decrease insulin secretion, as I mentioned. It will increase insulin resistance, and it will definitely lead to what is called impaired glucose tolerance. Stands for IGT, capital I, capital G, capital T. What's about IGT? Let's talk about that a little bit. Magnesium modulates insulin action and effects and insulin signaling at the receptor site. It is involved in glucose uptake. Low erythrocyte magnesium content can increase membrane microviscosity, which impair insulin interaction with the receptor. Magnesium deficiency will lead to increased intracellular calcium, which in turn will lead to insulin resistance. Tyrosine kinase activity is decreased in muscle insulin receptor of rats fed a low magnesium diet. And therefore, lack of insulin in type 1 diabetes or insulin resistance, type 2 diabetes, cause large amount of magnesium to be excreted through the urine. The European call diabetes a magnesium wasting disease. Apparently, the lack of insulin, which causes diabetes type 1, or insulin resistance, which is diabetes type 2, cause, as you know, large amount of magnesium to be excreted through the urine. And this is why they call diabetes a magnesium wasting disease, due to the excessive loss of magnesium in the urine. Insulin resistance and magnesium deficient result in a vicious circle of worsening insulin resistance and decreasing intracellular magnesium. It is very important to remember that a lot of magnesium, like in zinc, can be lost in the sweat, and therefore athletes who exercise a lot and sweat a lot, they are subject to magnesium deficiency. Oral magnesium supplementation improve insulin sensitivity by 10% and reduce blood glucose by 37%. Anybody who's interested in reading more about this statement, I would refer them to a couple of articles. One of them is oral magnesium supplementation improve insulin sensitivity in non-diabetic subject with insulin resistance. This was published in Diabetes and Metabolism in June of 2004. The second is that oral magnesium supplementation improve insulin sensitivity and metabolic control in type 2 diabetic subject. This was published in Diabetes Care in April of 2003. While we are talking about the connection between magnesium and diabetes, let's talk briefly about the connection between diabetes, heart disease connection. Magnesium, as you may know, helps the muscles to relax. Losing magnesium makes the blood vessel constrict, leading to hypertension. So you need to remember, some of the hypertension or the high blood pressure you see in some or several diabetic patients could be related to magnesium deficiency. Magnesium helps to correct abnormal lipoprotein pattern. It will lower triglycerides, it will lower LDL, and increase HDL. And therefore, the dyslipidemia or the abnormal lipid profile that is encountered in many of the diabetic patients can be improved by the administration of magnesium. If you need more information or if you need to know more about the connection and the relation between magnesium and diabetes type 1 and type 2, please visit our website at triolife.com. Thank you.